Award winner and Oscar winner who is also living with Tourette syndrome.
I did not know that. Tourette's is a nervous system disorder that causes uncontrolled movements like blinking or shoulder shrugging.
Billie recently spoke out about it, saying that she is sometimes incredibly confused by it.
So Dr. Laura Saunders from the Institute of Living is here to explain what this is. Hey, Doc, how are you? Happy Wednesday.
Hello, friends. Happy Wednesday. Great to be here.
I know. I actually have. I knew a couple of people with Tourette's when I was early in the business, and they struggled. It was a difficult disorder.
Right. So I like to talk about sort of tic disorders, and tic disorders. The category Tourette's is like a subcategory of tic disorders.
Okay.
And the CDC found that 1 in 50 children have some type of tic disorder. So this is not totally uncommon. There's some teens right now on social media who are getting like 1 million likes, and views around their talking openly about having Tourette's. So it is something to be talked about more openly in our efforts to talk about all mental health issues more openly, because tic disorders are classified in the Diagnostic and Statistical Manual as a mental health neurodevelopmental disorder, actually.
Yeah, so tell us a little bit more about what it is, because I guess boys are more likely to have it than girls, but many of these kids even go undiagnosed. Mm.
Right, so a lot of times you might just think, oh, my child seems to sniff a lot, or he seems to jerk his head to the side, or he seems to have a click of his fingers, or so you might not even realize sometimes it's a cough. There's two kinds of tics. There's verbal tics and there's motor tics. So like eye blinking or moving your head to your shoulder, those would be motor tics. Grunts or something coming from your throat is a vocal tic. So simple tics are usually just motor tics. It's not uncommon that kids get them. They can be exacerbated by anxiety and stress. Doctors did see an increase in them during COVID because of all the stress that we were all under. So a simple tic can come and go in about a year. It's tics that last longer than a year that we want to keep an eye on. But bring it to your pediatrician. Just be mindful that cough or that grunt or that sniff or that kind of head jerk may in fact be a tic.
What are there medications that can help a person? What's the treatment for this?
So there are treatments out there. It really depends on how severe it is and how much it's negatively impacting someone's life. If it's diagnosed as a simple tic or developmental tic, they might really not do anything. They might work on some stress management or some positive coping skills. If it's a more complex tic or Tourette's, which again is both a verbal tic and a motor tic, there are some treatments. Cognitive behavioral treatment really is often the treatment of choice to really work on thoughts. You may not be able to totally eliminate them, but to sort of decrease their frequency, because what people describe is it's like a pressure inside of them. Mm. And that pressure builds up in sort of really in the motor neurons, and boom, it just needs to fire. So it's not like they can just stop it, and they're not lazy. There's nothing pejorative about it. It's a real and true phenomenon.
So what about sometimes in the movies you'll see someone shouting swear words? Mm-hmm. Is that part of it?
So yes. So corporalia is part of Tourette's. Probably less than 10% of people that have Tourette's have that corporalia, which is where they might shout an expletive, and it could be a body part, it could be a swear word, and that's part of the Tourette's. And again, very often the individuals that have Tourette's or have tic disorders are very self-conscious about it, which unfortunately then sometimes makes it worse. So it's not that they're trying to make anyone upset. It's actually like an unconscious process that really drives this.
And, go ahead, Ken.
I was going to say early intervention is important.
What I was gonna say. Early intervention?
If you think this is happening with your kids, talk to your pediatrician. That's step one.
Yes. We can pretty much say this about anything. Early intervention is really the best way to deal with any issue. But early intervention, when you just notice like some motor tics or some facial grimaces or like an excessive kind of tapping or touching, bring it to your pediatrician's attention. And again, they might want to track it over time. There are treatments. There are some medications if it's more severe and if it's really having a negative impact on your child's life. But let's get it diagnosed. Let's get it out there that this is not about being lazy. This is not about, someone doing it on purpose. These are unintentional tics, and they're often a symptom of anxiety.
All right. Thanks, Doc. We appreciate your time. We're bringing this to our attention. It's an incredible, disabilitating. What do I try to say? Disabling disease.
Disabling, yes. Well, and it's also good if people understand it. Yeah.
All right. Thanks again, Doc. We appreciate your time.